afternoon, everybody, and welcome to our COVID-19 Vaccination Clinics Practice Expansion, Sustainability and Effectiveness Lessons Learned webinar. My name's Kate McIntosh. I'm the strategic lead for the COVID vaccination program, and I'm just providing some introductions today. Firstly, I'd like to acknowledge that we're all meeting on Aboriginal lands. I'd like to acknowledge the traditional owners on the land on which we live and work, and pay my respects to elders present, past, present and emerging. I'm currently on Dja Dja Wurrung country here in central Victoria, and each of you are on Aboriginal land which has not yet been ceded. We recognise, celebrate and respect the Aboriginal and Torres Strait Islanders people as the first Australians. We acknowledge the unique cultural and spiritual relationships to the land and waters as we strive for healing, equality and safety in healthcare. Today, the information provided in today's webinar is for information purposes only and does not take into account any individual circumstances. Practitioners will need to make their own professional judgment on a case-by-case basis. So Dr. Sue Furphy is facilitating our webinar today. Sue is a GP principal at Murchison Medical Clinic in Murchison, Goulburn Valley region, and she's a GP medical advisor for Murray PHN. Sue's clinic are very active participants in the vaccination program, and Sue has a lot of expertise and experience to share in this space. So welcome, Sue, and enjoy the webinar, everybody.
Thanks, thanks, Kate, and welcome everybody. There's certainly been a lot of great work across the Murray PHN area in this quite stressful pandemic time, hasn't there? And we hear that there have been nearly 250,000 doses delivered by those in the primary care sector. So that's a real pat on the back, I think, for general practice. And overall, the catchment vaccine rates are about 67% first dose and 42% second dose, with variability in different parts of the catchment, but that's the overall rate. So a bit of work ahead to do, and now of course we're expanding into Pfizer delivery too, and we're up to, I think, 113 practices are involved in vaccine delivery across the catchment. So how do we do this in a safe, efficient and cost-effective way for the practice? It's really terrific that we've got 3 of our practice managers today who are going to give us the lowdown on how they're running their clinics, so that we can share experiences and refine our modelling to best meet the challenges ahead. Each speaker will basically talk to what they've been doing in their clinic, and then we'll have time at the end of the session to answer some of the questions that have been put through before the webinar, and also those that are raised on the chat line today. So to kick off, our first speaker is Lindy Ronan, who's a practice nurse and owner of, as well, of Yarrawonga Medical Centre.
My name's Lindy Ronan. I've been involved with the Yarrawonga Medical Clinic now for 39 years. It was never meant to be that long, but it's just how life evolves. I'm a nurse. I'm not a practice manager, but I do a lot of paperwork, etc., with accreditation and every other aspect of practice management, I guess, to assist our practice manager. I don't know how anyone could have done this as a practice manager with everything else that you have to do, and then this COVID situation on top. I'm hoping that everyone's had a lot of help from their staff and been able to share the responsibility. We started our vaccines on March 17th, and I completed our expression of interest and we were accepted, and we started off with the most vaccines that we could deliver. I can't even remember now how many AstraZeneca we were doing. I think it was, from memory, 400 a week. And we've continually built up since then, and we're now doing Pfizer and have been for several weeks. We do clinics every day. My nursing staff have been absolutely amazing. They've stepped up and just doing extra time. My receptionists have been bombarded with phones, as everyone, and they've been exceptionally helpful in delivering this very successful program. I did a little recce yesterday, and we've given over 7,000 vaccines since March 17th, And we got our PIP payment the other day for our second doses, and it was close to 12,000. So that gives you an indicator of how many second doses we've given. It's all become a bit of a blur now, really, because every day the first thing I think about in the morning is vaccine delivery. The last thing I think about at night is the vaccine delivery. And I'm sure everyone listening to this webinar would be feeling much the same. We're lucky in that we had a bit of a trial run last year during lockdown when we were doing flu vaccines, because we give a couple of thousands of those a year. So we already had a model in place for when our AstraZeneca arrived, with moving people through the building who would be responsible for injecting all of those things. How many open windows? Yes, Mark Jennings, I did listen to you. How many open windows we would have, how many open doors. We're lucky enough in this building, which we built in 91, that we've got a very separate entrance at the back, so that people don't have to come through the main body of the building, where we're still running general practice, obviously. The only way that we thought we could do this was with cooperation of our clinical staff. The doctors have decided that they'll come in on their afternoons off or their days off to do clinics for me. We run several different models. We run a nurse model with the doctor, the principal doctor in the practice, obviously. The setup that we have in our West Wing, as we call it, can seat 12 people very comfortably at 1.5 metres apart, plus we have a lovely paved area outside with access via the back door, and we have a treatment room just opposite, which we've been using a lot for the young men who've been coming in for Pfizer, who tend to get a bit faint and weak at the knees. So generally our setup, our physical setup, has worked very well. I hope that no one's gone into this expecting financial reward, because that certainly hasn't been our experience. And I'd like to perhaps know from others participating in this how we could do it better. Our doctors are still receiving their percentage, plus I have to pay, nurse time. We have a nurse concierge every day who welcomes the patients into the building and log them into the system, ask them if they've been outside the bubble, give them their next appointment, and then they oversee the people who've been vaccinated just to make sure they're all feeling well, and make sure they sit there for their 15 minutes. And then the patients come into another room where the doctor and the nurse are, or two nurses, depending on the model that we're using at the time. I think with all the hardest thing that we have, that I have found, because I'm basically the one running this, is the changes that come about, halfway through doing a clinic. I just, Scott Morrison or Daniel Andrews or someone will stand up and say, now this is what we're doing now, and the patients know about it before we do sometimes, and that I find that immensely frustrating. The patients seem to have access to information on the spot. In fact, someone was sitting in our waiting room the other day waiting for a vaccine and came in and told me while I was halfway through the vaccine clinic that pregnant women were now allowed to get the vaccine. So they knew before I did, and I find that immensely aggravating and upsetting, and I'm sure others have felt the same. I'm not sure that you need to hear much more about how we do this, or if you do, then please give me a hoy.
Our next speaker is Belinda Cara, and Belinda's the manager of the Littleton Street Medical Clinic that's in Castlemaine.
Hi everyone, my name's Belinda, and I'm currently the manager at the Littleton Street Medical Clinic in Castlemaine, and I've only been here 6 months. I arrived my first week to a delivery of 400 COVID vaccines. So I've got a background in general practice for the last 30 years. I've worked for the divisions of general practice, the Medicare Local. Some of you might remember me from my role in those two positions. And more recently, I've gone back to practice management as I wanted to be able to work closer to home. So And now I've landed this brand new job in this fabulous town called Castlemaine. So Castlemaine, actually, and the Mount Alexander Shire, according to the Herald Sun, has one of the I'll try and hold this up, we couldn't believe this. We have one of the highest rates of COVID vaccinations in Victoria, aside from the borough of Queenscliff, which I think technically doesn't count because it's not an LGA, it's a borough. So I noticed that Lindy just said that they'd done 6,000 vaccines up at Yarrawonga, which is amazing because we've only done about 2,000 in Castlemaine. So we probably haven't had as high a demand as obviously there has been up around Yarrawonga. So when I first arrived here at Littleton Street, the practice had only just changed all their software to best practice. And the first thing I did to try and manage the whole COVID situation with the vaccines was I put in an online booking system called AutoMed. So there's many online booking systems out there, and I think that was the best decision I made right from the beginning, was to try and automate everything I possibly could in the practice. So we've gone the full hog with AutoMed, including a lovely new checkout chick at the front door, or check-in chick, I should say, where patients can just put their Medicare card in and arrive themselves into best practice. With the AutoMed system, patients can reserve a vaccine, and then when the stock arrives in the practice, a message goes out automatically to say they can now book their appointment. So you can't overbook. You can only book what's come into the practice. It has relieved some of the pressure on the receptionists, which has been absolutely huge. So I'm sure you're all experiencing the same thing, that the receptionists are overwhelmed. So the reason I started all of this was to try and relieve the pressure off the front desk. With the AutoMed automatic check-in system, all of the patient's information is updated and the consent form is all already done before they even arrive in the practice. So the way I've looked at this is that the three most important things for success in running the clinic efficiently, both financially and effectively for the patients that are coming in, is keeping control of the stock, keeping control of the staff, and keeping control of the seating arrangements. So probably with the same for most of you is that, you know, where are you going to sit these people for 15 minutes after they've had their vaccine? So once I worked out how to get those things under control, and I kept regularly updating everybody in the practice about how this was all going to work. We've actually had some fabulous feedback from the local community about how well our sessions have run. So basically what happens is we've organised to do the sessions just on a Saturday. So we originally started doing the AstraZeneca's every week morning before we opened at 9 o'clock. So we started from 7 till 9 because we really didn't want to lose our core business. You know, we still had to be looking after all of our usual patients as well as providing this extra service. Now that we're on the tail end of all the AstraZenecas, we're still mopping up the second doses of those at the moment. We don't seem to have the demand for the AstraZeneca that we had, and we've had our first delivery of Pfizer last week and our first clinic last Saturday, which was a full day. We did 150 last Saturday with 3 doctors, 3 GPs in the building, 1 nurse and a receptionist. So the main role for the nurse was to draw up the vaccines, and either one of the doctors double checked the drawing up. We did get to the end of it and realised that there were a few shots short because somewhere along the line it got mucked up. So we had a few lessons out of that. So this week I've been chasing two spare vials basically, because we need another 2 vials for the next shot in 3 weeks. I've found that I don't have a nurse that's helping me really with the ordering. There's been a change in the whole nursing team since I've arrived, and so I've had to manage all of this myself. I'm not a nurse, I'm a practice manager. So the GPs that own the practice have been my main support, and they've helped me with the clinical side of things while we're settling the new nursing team in. We've still managed to get it all done, but it has been a big job. So the other thing that I've been a little bit disappointed in is finding out that our standard whole patient equivalent had dropped when we got the last PIP statement. And I find that really very deflating, given that we've all worked so hard, as all of you have. So not only were the telehealth consultations not included, but the actual vaccines that we've given for the patients for COVID, those item numbers weren't included either in the PIP. I know we do get the extra $10 payment, but I still don't think that covers it at all. As Lindy said, none of us are doing this for financial gain. That hasn't been the case at all. And, you know, we're doing it for our communities, and it's been a hard yard, very hard yard on top of your normal everyday business. And I've been very fortunate that the whole of the staff here, same as Lindy, have all been very supportive, but it still has been a lot of extra work, even down to the purchasing of all the extra PPE that we need and all of those things. You know, there's a whole range of things that we've all had to lay out extra money for, and you know, you've got to find some way to pay for all of that. So it's been very rewarding, but also quite stressful on the whole practice, because as Lindy commented on, the media is ahead of us, and that's just so frustrating, you know, that we're getting phone calls from patients telling us that, okay, they've turned 60, they can get a vaccine now, and where is it? I want it right now. And the new guidelines for anyone that's 60 for a Pfizer vaccine are quite detailed. They have to have specific conditions. And so yesterday I made a rule here that anybody that was 60 or above requesting a Pfizer had to have an appointment with a GP first, because I don't really feel that's the receptionist's role to start working out whether they actually qualify for it. So I think the hardest thing has been changing everything on a daily basis almost. You know, and how do you bring your team with you on that journey when you really don't know what the journey is yourself, and they're all coming to you as the practice manager or the lead nurse, and all they want is guidance. You know, and my biggest advice to all of them has been, let's not react immediately. Let's just give ourselves a day to think about all of this, you know, and just slow down. One day will not make any difference. But,
that's been a real challenge, hasn't it, Belinda? Yeah, I agree. Yeah. Well, thank you so much for that.
Okay.
But it is a real. I think it has been disheartening, the lack of counting of telehealth for the PIP payment. It's a real matter of concern, isn't it? I know the CEO of Murray PHN is well aware of that and is advocating at this time anyway to try and see change to that. It's certainly something that we want to see addressed. Interesting to hear. Thanks so much, Belinda, for all of your insights. Our third speaker is Rhonda Rose, who's the practice manager of Wyndham House Clinic. And as well as describing the vaccine arrangement, Rhonda has first-hand experience of that situation that we all dread, having to close the doors because a COVID-positive patient has been seen in the clinic. And so we'll be really interested to hear how you dealt with that as well, Rhonda. Thank you.
Thank you. Okay. Now, I've been in this game for 20 years, but so I'm a relative newcomer compared to the other two, but I'm here at Wyndham House for the last 8. We're a 10-doctor practice located in the CBD, or on the edge of the CBD in Shepparton. And we've been doing vaccinations since we could first do them. The 29th of March we started AstraZeneca, and the 1st of July we started the Pfizer. We started off doing 2 days a week with the AstraZeneca, and once Pfizer came, we decided we better do 1 day of the AstraZeneca, 1 day of the Pfizer, so neither of the twain should meet. We average around 130 to 150 a day, although the Pfizer ones are increasing now. We started off at a fairly slow pace with much less than that, and the doctors soon said, we can do more than that, so we've upped it quite a lot. We have a doctor and a nurse in the room where the injections happen, and we're very lucky. Our clinic is really big, and we can totally separate where the vaccination people come in. They don't have to come through the main part of the clinic. We have a very long, wide corridor and an entrance at the other end of the building. There's also a spare reception desk there and a doctor's room that we can use without mixing the patients with our general public patients. Our bookings are all done. We started out by trying to get or encourage patients to book online as much as we possibly could. That didn't work very well when we were up with the over 60s patients. They don't have that capacity, and a lot of our patients just don't want to do that. We still try and encourage them to do it, particularly new patients, to try and encourage them to do that, to fill out the registration forms online so that we don't have to do those when they walk into the practice. We have a lot of patients that are not ours booking because we're one of the few places in Shepparton that do Pfizer other than the hub. I think there's one other practice that's doing Pfizer. So we try to encourage them, or we email them the consent form and the registration form if we can, so that can all be part of the process before they get here. We have the doctor and the nurse in the room, plus 2 receptionists, one at the check-in desk, one welcoming at the door to the corridor and instructing them where to sit to wait, and also they are in the same area that monitors the patients on the way out. When the patients come in, we give them a number, so the doctors at any time keep calling those numbers in order so they know how many they've gotten through, what their dose count is going for that particular session. On a Monday, we do morning and after sessions on both days. Like the other practices, getting doctors to do it, I've scrounged doctors in their time off to come back in. We are short a couple of times that we have to use a doctor that's normally seeing patients, but we've tried to keep our core business seeing the patients, not taking doctors off seeing people that are unwell to go and do the vaccine clinic. So far that's worked reasonably well, but it is a huge load for the doctors coming in to do that on their days off, because those doctors also see nursing home patients, and we have a huge number of nursing home patients on our books, so juggling that's been a bit of an act. Paperwork process, when they bring their consent form in, the doctor fills that in. We try to keep that and file it in the old-fashioned way that you used to when you had a card for each patient, and retrieve that so the second one can be signed off on, and then it's scanned into the patient file. We're registering every new patient we get into the building, so it's easy to just send their data to the immunisation register. That's going to affect our patient numbers and our whole patient equivalent and our PIP numbers and all that sort of stuff. So we haven't yet figured out how we're going to then archive those patients who've only been here for a vaccine and not anything else. So that's a process yet to happen. Problems with the things that are happening. Problems, we give the patients allocated time. For the first doses of Astra, the doctor used to go out and while the nurse was drawing up the second 10, he would give a quick briefing on this is what the AstraZeneca is all about. There's nothing to be worried about. Now that we're getting into second doses, that's not happening. Now patients are arriving like you might give them an 8:30 time slot or a 10:30 time slot, and they'll all come at 8:30. So we're having to manage that at the door and just say, look, just wait outside, wait in your car till it's your time. That's been a bit of an issue, trying to overcrowd so we're no longer have got our COVID safe spacing. Managing the excess doses, we haven't had a problem with. Now that the pharmacy in our building is doing AstraZeneca, that's been quite easy to manage that. If we're 1 or 2 doses short, just pop into the pharmacy and they'll give it to you in there. That's not been an issue. We're booking in batches of 10 or batches of 6, so we can control the numbers. We do, and lately, of late, since Shepparton's lockdown, we've had no shows, but we've always been able to sort of manage to bring some forward from the next session, or there's somebody in the waiting room that, yes, I'll have it today. There are people who live close by that I booked for the next week. We'll try and slot them in earlier. So we haven't had too much of a problem with managing the excess doses. We've managed to get it within 1 or 2 each session. I agree with the phones just going crazy, and we have been short-staffed anyway during the lockdown that you'll hear about in a minute. We were desperately short of staff because, as you know, half of Shepparton was in isolation because the problem with the schools, and we had key staff out of the makeup. So, but just staffing in general, trying to manage. Yes, you're using casuals to come in and answer the phones. In a few months' time, we won't have any work for them. So that's been a difficult thing to get across. I'm just looking here. One of the things that the girls running, I think, have said to me, that on the consent form where it says the Medicare card, it doesn't have the expiry date for the Medicare card. So our issue has been, okay, yes, you've got a Medicare card there, but then when we've gone to bill them, that won't go through because it's an old Medicare card. They're not a patient of ours. So then we're going into Proda to get the updated Medicare card. So that sort of thing has caused even more work. So it would be nice if that consent form had expiry date of the Medicare card, so we knew that we were in order there. I agree that the media and the public are tending to know, or they think they know, so that's also caused us a problem. Other than that, our problems and our things have been pretty much the same as the other 2 speakers, so I won't go too much more into that, but I will now address our lockdown issue. On 3 weeks ago, on a late Monday afternoon at 5 o'clock, we got a call from the public health unit to say that you're a tier 1, close immediately, everybody go home and have a test as soon as they can. And that sent us into a big panic, and out came my little COVID plan that I'd written last year for these things. And so there was only one doctor left on duty. She saw the patient that was in the waiting room, and I had 4 staff still here. I said, I need you to stay for a while. We've been working in this atmosphere since last Wednesday when this person was supposedly in here. Another few hours of changing patients is not going to make that much difference. So we worked as long as we could, moving all of our patients to phone consults if they could. Others, we told them that we would call them again in a week, or to call us back in a week and see where we were. We had been advised that we would get an email from the Department of Health sometime that evening. That came through at 5 to 8, and they needed a huge amount of information, our login sheets, our patient lists, where everybody, a map of the building, where everybody in the building had been working, the doctor and the nurse that were in the room with the patient. It was one of our Vax Clinic patients. The doctor and the nurse that were in the room with the patient were definitely tier 1. The 2 staff that were on the desk and monitoring the patients afterwards in our Vax Clinic were tier 2 with restrictions. They needed to be furloughed for a week, but we would get more notice on what happened there once the department all had our documentation. So I let the staff go home, and then I was here till 10 that evening preparing everything to send off to them. And we were told that no matter what, we had to do a deep clean. So my first task the next morning was finding somebody to do, first of all, keeping the staff and people updated. At that stage, I chose not to change the "we are closed" message because it seemed to be that things were going to keep changing over the week. So I chose to just leave our after hours message on that we are closed. I did update our website on a daily basis, but finding somebody to deep clean was a new challenge. When I first wrote my plan last year, at that time I called PHN and said, do you have a list of people that are accredited to do this? Or if you haven't, can you please develop a list? They said, what a great idea. So my first port of call was to PHN, and they were all working from home, so they were all at a disadvantage that they didn't have access to all of that. And there'd been a turnover in staff since then. So that was a challenge. I'd spoken to a few of them, and no, they didn't have a list. So I then rang back the liaison person that I'd been dealing with from the Bendigo Public Health Unit, and she wasn't aware of anybody either. She was very helpful, but not aware of anybody. So the next course was one of the major pharmacies in town had a lockdown, so I rang them to see who they'd used. Their head office in Melbourne had organised somebody to come up from Melbourne for them, but they weren't sure who they were. So one of the other smaller clinics in town I know had an incident the week or so before we did. So I called them, and I was lucky they were closed. They'd finished their deep clean, and the department had let their practice manager go back in to keep everybody updated. So she very kindly gave me the name of the people in Shepparton who'd done their deep clean. During the process with this too, I'd gone online to get every cleaning company in Shepparton and left numerous messages, and I hadn't had any replies by about 10:30. So when I rang this other clinic, they very kindly gave me theirs, and this company rang back within an hour or two, and so I was able to organise them. Because we are a huge clinic, it took 2 days for them to complete the deep clean. And something that I've learnt that you really need to do, in the 4 hours that I had the staff here, we decluttered the reception area as much as we could, but it's really important that you have doctors decrease the clutter in their room. We have some doctors that have just the most friendly, welcoming rooms, but they are full of ornaments and bits and pieces. And the cleaner said to me, that room took us a very long time. And I know these rooms make patients feel comfortable, but you really have to get it across to your doctors that please declutter. It's going to take the cleaners a longer time. It's probably not as hygienic as it should be. So that's one of the issues. The issue at the end of it, I mean, we successfully had 4 or 5 of our doctors making phone calls or working on the phones. Most of them we found a problem with, they couldn't print from home, so that's a challenge to me now to see how we can set that up. But they managed with the scripts to their smartphone, and a couple of the doctors had the brainwave that they would contact the pharmacy or the pharmacist at a couple of the pharmacies and say, look, have you got a smartphone or somebody, one of your pharmacists there with a smartphone that I can send this to, and you can then download it and work that way. So that worked quite well. As far as printing referrals, they've just saved them all up and they printed them when they came back into the building. So that's been managed. I'm looking at possibly setting up a printer here to be able to do that if they're working from home, but that's not for a lockdown situation. We did go back to, oh, that's right. So once we got all of the paperwork, now there was a huge amount of paperwork that had to come through from the cleaning company. Everything has to be accounted for. They do the deep clean, every bit of equipment they use. They have to get clinical waste bins up from Melbourne. That's a department requirement. So every bit of equipment they use, buckets, mops, cleaning, everything that they've touched, clothing on every shift that they do has to go into these clinical waste bins, which then have to be collected. So when they did their final clean, they sanitised the bins, sanitised the area, the bins were cleaned. They had to then come back in and finish off that area and then sanitise again. So after that, they sent me through their final paperwork, I think at 8:30 or 8:45 on the Friday morning. I sent that off to the department straight away with a a message that we were a mental health issue in Shepparton because everybody was locked away. We really needed to be open to see patients. And 3 or 4 phone calls that day to the department, please, 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 can you address this one? And each time the lovely lady in Bendigo I was dealing with would say, it's gone to the panel, but they're taking their time. They've got a backlog. I don't know whether they had a backlog of medical centres, I doubt it. But eventually my pleas were heard in that, look, we really need to be open for these mental health patients in Shepparton. They finally sent through, I was allowed back in, but none of my staff. So yes, I was at risk, but my staff couldn't come in to prepare for opening. We finally got word that we could open on the Saturday at 4:30 on the Friday afternoon. So that was a mad scramble to get the word out that we were open again. And we normally have 1 doctor on a Saturday morning. We had 4 come in, and we had 5 staff come in to not just work that Saturday morning, but to prepare for the opening on Monday and to prepare for a fully booked vaccine clinic on the Monday. So yes, we learned a lot of lessons. I think there's some things with communication that I have to address from that lockdown. There are decluttering of rooms. I certainly hope that PHN, I have given the name of the company we used, and they were delightful. They're a local company. They do some of the nursing homes. They've been doing a lot of the cleaning here in Shepparton, but they are a delight. And being a local company, I think, yes, it's good to use local.
Well, thanks so much for all that. Just before we go to the questions, I'll just add in briefly, because it's a bit, our circumstance in Merch is a little bit different in that we've shifted to doing all of our vaccines at drive-by clinics. We're pretty fortunate to have a large area at the back of our clinic and a separate driveway, and so we've set up a sort of marquee structure attached to the practice with you know, computer and couch, and there's an undercover area for cars to drive through, and so that's worked really well for us in a sense. So if anyone's thinking of that, we can discuss it more. But gee, what a lot. That's been really interesting hearing from all 3 speakers. And I guess we might move now to questions. We have 20 more minutes for questions, and there were a couple that had been sent in ahead of time. So maybe we'll address those first. What do you think is the minimum number to be vaccinating each week to make the process sustainable, both logistically and financially? Does anyone want to talk to that one?
I've had 3 doctors running a session with 1 nurse and a receptionist. This is how we run ours on a Saturday. And if I've got 3 doctors running, it's profitable. If there's 1 doctor, 1 receptionist and 1 nurse, you don't make anything at all.
So I did some figures about a Saturday that we'd done. We often do big Saturday clinics for flu vaccines, and they've always made a small profit for the practice, probably because you can add the incentive, you know, the 10991. Whereas with these COVID item numbers, they're very restrictive, aren't they? And on a Saturday, we had 3 nurses, 2 doctors and 2 receptionists. And of course, the nurses and the receptionists were paid time and a half for Saturdays. And the doctors were still getting their quite large percentage. And I did the figures, and I sort of wished I hadn't, because we made a small loss. And that didn't count my wage. And I'm there all day, every day. So I just thought to myself, no, we really wanted to do this for Yarrawonga and for Australia, for everybody, but I can't do it at a loss. That to me just doesn't make sense. And so we've stuck to weekdays, and we always have 2 nurses on the floor at any one day. So some afternoons I've been able to utilise one of the floor nurses, and by having me doing the doctor's job, I guess. And having the principal doctor on the practice floor to help us if we need it. Yes, we do make a very small profit, but really it's not about the profit, but just to run a business, you can't be running a business at a loss. And I don't think there'd be many people out there who would accept that. We're going to keep going. We're getting 900 Pfizer a fortnight now, and I've just actually ordered another 400 AstraZeneca because I've had another bit of a surge. So we're doing it every day, and we'll keep doing it every day as long as the demand's there. But I think we've probably got to talk to, I don't know who we talk to and how we go about doing this, but the federal government has to recognise that general practices cannot keep sustaining that financial hit with, you know, the PIP, the swipey, the, you know, ad nauseum. Just
Agreed.
can't.
I think there are a couple of questions, Lindy, with Yarrawonga. How many practices? I think there are 2, aren't there, in Yarrawonga?
There are 2. So yes. The other
and
practice have now come online with a small amount of Pfizer. They were getting an allocation, I think, of 50 AstraZeneca a week. I don't know whether that was their choice or what, but we've now got the NCN hub that comes from Cobram Way coming to the local hospital as well. Plus, we've got 3 pharmacies delivering AstraZeneca. So we're pretty well covered.
Thank you. There's another question. What information needs to be given verbally to patients prior to receiving the vaccination?
With the initial AstraZeneca ones, the doctors were doing a briefing because there was so much kerfuffle about the AstraZeneca is dangerous. He would just go through some of the things to, no, it's not, these are the side effects. We also give them the information brochures that are on the website, the COVID website. There's like the information brochure on AstraZeneca and information on Pfizer, and it goes through what side effects you might expect. We also, as they're waiting afterwards, they get the after your vaccine, what to watch out for. So that's all there. So while they're waiting to go in, they've got the consent form and information on the thing. So if they've got any questions from that, they ask the doctor when they're in there. But it's a very small time that you've got frame that you've got to do that. Most of the patients are pretty well aware, but the opportunity is there to speak if they need to. So answer the question.
Sorry, Rhonda. I was just going to say one other thing. We've been doing at ours. We haven't started Pfizer yet. We're to start next Monday. But with the AstraZeneca, with people when they were seen in consults, we had an autofill with all of the consenting thing, and the doctors would see when they were seeing the patients, they'd fill in that autofill, and then it would be flagged in reason for that all of that consent issue had been taken place in previous consultation. So that was a really helpful thing, and we're at an advantage too because most of the people coming here were patients of the clinic. So you can do a bit of work beforehand too, can't you, really, to flag it? And we had that so that for the people doing the clinic, they could actually see if that had been done before and just recently and just talk to it very briefly. So that might be a helpful thing.
That was good. With our own patients, yes, you could do that, but we're getting such an influx now of patients now that we're doing Pfizer, and you can go to the hub and get Pfizer, or you can go to us, or you can, I think maybe Delta might be doing Pfizer, but there's not very many places that are doing Pfizer, so we're getting a huge influx. We have also, I noticed one of the questions in the thing, we also contacted businesses that we deal with every year and do their flu vaccines, or we do their work cover, or we do their pre-employment medicals. We contacted all of them, and we've got staff from there coming in. We contacted all the teachers, and now that the schools can get them, we've contacted all the schools. So we've reserved spots in our Pfizer days for those people. So we're getting a lot of people that are not patients of the practice.
Yeah, that is amazing. That's a really good, you're doing so well with that. Rhonda, there are a lot of questions about your lockdown process. I think it's trying to knife to our hearts. We live in fear of that happening, don't we? Because just the chaos that must have ensued. So there are quite a few. Someone has asked, Rhonda, how did you answer the phones if no one was in the building?
Well, no, the phones weren't answered. The night message was left on 24/7. So all they got, because things were changing, like initially we were tier 1, then we were tier 2. Does everybody in the building have to stay out? How long are we going to be closed? And rather than try and update the message every 5 seconds with something different, we chose to just leave that "I'm sorry, we are closed" message on there. I communicated as much as I could with staff and groups that wanted to know with a mass text message, all from my thing. And I had access, I can log in from home, so I could do mass emails and whatnot if I needed to. I had one senior staff member that helps me run the COVID clinics, that one of the nurses has a laptop that she takes out to, and I said, quick, take that laptop home on that first night, and can you try and contact, I don't need you to use your personal phone, but if you can email as many of those people who are coming in for those COVID bookings, because most of them had given us their email address to send information out and whatnot. So that was one of the things on the forms that were required. So she was updating those people via that. Yes, we got criticised for why didn't you put it on the government website that you were tier whatever? We don't have that responsibility. That's the government that puts you on. If you're an exposure site, that's theirs. I can't deal with that. I kept putting it on our website. This is what's happened today. This is where we are today. I can't give you a date that we'll be open, but keep watch on this site and you'll see when we're open again, or call and get through. It's been a nightmare answering phones since we've been back, but I probably learned some lessons on. I've got to spend some time with HotDoc on how we were to do it. I initially thought, okay, I'll try and go through HotDoc and send a message out to every patient who's got a booking. When I tried to run the thing out of Praxoft to do that, I got 6,000 patients. I'm not sending that many messages out, so I couldn't refine that. And then that was something that I didn't really have access to that level from home. Having 2 of us being able to log in from home to do things. And
how did you have receptionists scanning from home? That's another of the questions.
No, because there was nothing much to be scanned. It was closed. Business was closed. As soon as we opened again on that Saturday morning, I had my scanners back in trying to scan everything. But a lot of our stuff comes in anyway through downloads and things like that. But yes, there was things to be scanned. I got a giant bag of mail as I went past the post office on the way in on Saturday morning, so the staff then had that to scan through, but there wasn't any requirement for scanning in those few days. The doctors were all happy that, okay, I'm going to write a referral. I'll have to pick that up and sign it when I'm next in there. And they had told the patients that on the phone. And their scripts they could manage, as I said, by the smartphones.
And there's one question that probably encapsulates a lot of the information about the clinics that might be a good one to close with and get some input from Lindy and Belinda and Rhonda. And that's for someone who's just starting out having a COVAX clinic, what works well? What would you recommend? What would be your important things that you'd say put at the top of your planning list? Do you want to comment to start with, Lindy? Oh no.
I'm unmuted again. That's all right. Yes, I think you need to work out who's going to be the figurehead, who's going to put it all together, because it's no good getting someone to do this and that and then the other.
No.
Everyone, I've almost found that everyone just stops thinking all that. So try and disseminate all the knowledge, but have one person in charge who gives everyone else a daily update. This just happens to be made. It doesn't have to be clinical, but you just need the figurehead to pull it all together. And then I've found that everyone will work really, really well if they know that there's just one person that they can come and ask and feel happy about.
That's a really good point. Belinda?
One golden point, automate it. Get your bookings online. When I researched it all, AutoMed was ahead of the rest of them. So, but HotDocs is just as good. There's a point to it. There's many different systems. So if you can take the pressure off the front reception staff, that needs to be the priority. Because we all know that we lose the staff if we don't look after them.
Yeah, exactly. And Rhonda,
Staff
how
are the
about
most important out of all of it. Look
yeah,
after the staff.
yep, really good salient point.
I think the organisation, and as Lindy said, having one key person. I've got one key person that manages the diary for and manages how many per slot, and she's keeping an eye on all day, every day. She's consumed by this, keeping an eye on the numbers and slotting somebody up into this when somebody cancels, and just keeping an eye on it. Because we've tried to always make the second appointment for the second dose when you first make the first one, they're checking whenever the second doses are there, or when the first, is there an appointment? And she's having cards ready for them, like when you come in for your first dose, okay, you've already got a card to take home. Remember this for your second dose, this is the time.
Yeah.
So managing those appointment diaries has been really valuable, and I've got the one person in charge of that. It's a huge job, and it's got to be managed properly.
I think that's, gee, what a wealth of information. Thank you so much, Rhonda and Lindy and Belinda.
Thank you, everybody. Thanks all the panellists and Sue for facilitating today. It's been excellent. So yes, this is the Murray PHN website for the COVID vaccinations. We try really hard to stay on top of the information. Unfortunately, we tend not to be in front of it. And I think when your patients hear the updates is the same time we hear the updates and we throw our hands up in the air and go, oh no, this is not great. So we feel it with you because we're sort of on that treadmill as well, trying to keep up to date with that information. Any questions that haven't been answered, we'll do a mail out after the webinar with the link to the webinar. So we'll address any questions there, and we'll also utilise our Wednesday email updates. So please do check our email updates. We do try and keep it on top of that information and provide the updates there. If you're not receiving them, let us know. So send an email through to covax@murrayphn.org.au and we'll add you to the list. But yeah, once again, thanks to the panelists. It's been great.